Physiotherapy after surgery is not optional, it is the surgery. I am Dr. Srishti Rai, physiotherapist at Trustin Hospital. Your surgeon did an excellent job. The procedure went perfectly well, but here's what nobody tells you clearly enough. The surgery fixes the structure, whereas physiotherapy restores the function. And without function, structure means nothing. I often see patients undergoing knee replacement surgeries, ACL surgeries, rotator cuff repair, or a spinal disc surgery. The operation is successful, but they skip the physiotherapy part or does it half-heartedly. 6 months later, the patient complains of pain, stiffness, and are still dependent on a walker or support. And then they say the surgery didn't go well. No, the surgery was successful. The rehabilitation did not take place. Post-surgical physiotherapy is not a supplement, it is the other half of your treatment. Because it is what teaches your muscle to work again, it builds your strength around the repaired joint and refrains your brain to trust your body again. At Trustin Hospital, each post-rehab programs are specifically designed for each patient, each surgery, each goal and each body. Whether you have undergone any knee replacement surgeries or a spinal disc surgery or any fracture or fixation, whatever surgery it is, your treatment is not complete if the physiotherapy is not complete. So, book your appointment at Trustin Hospital and let us finish what your surgeon started.